Good afternoon. Welcome to Neethu's Academy live reading with me, 𝐓𝐢𝐩𝐬. First of all, please accept our sincere apologies for yesterday because we tried our level best, but we were not able to come. So very, very, very sorry for that inconvenience caused again. Okay, because there was some technical glitch in between, so we were not able to really come in front of you. Apart from that, we would never miss an opportunity to come in front of all of you. All right, so welcome back for the last day of this week, because day just goes very, very, very quickly, isn't it? I can really know that I was just talking about this fresh week, and now it's already 5 days. Now, would you be kind enough to tell me how you felt about how you felt about the past few days that you have been attending? Are you all able to get right? So are you getting benefit out of what you have been doing? Are you improving? What are the things? I'm just gonna ask you all how you felt. Right. So as things are and students are getting in, so would be really looking forward for another lovely session with all of you. Yes, I hope you are also the same. You wish to right. Right, I'm just gonna just see who are the students who have just joined. So maybe some, again, maybe with the adverse weather and all those things. So those are the things why we are not able to, it's just times it happens. Welcome to God's own country, isn't it? You would never know with the weather. It keeps on changing. Right. So yes, I could see a lot of good afternoon. Rishika, good afternoon. Jinsi George, good afternoon. Chindu Sunny, good afternoon. Kalai, good afternoon. Blessy, good afternoon. 𝐓𝐢𝐩𝐬, good afternoon. Bonnie, good afternoon. I'm doing good, Bonnie. Thank you very much for asking. And how about you and all the others? Are you all doing great? Reba Sissin, okay, new name. Good afternoon. So is there anybody who's attending the live for the very first time? Please do let me know. That's for, to know, to add on to my knowns people list. That's the only thing. Apart from that, it's all for each one of you. Because, and also the reason why I keep on asking, are you new, is because there are n number of students who share the very same link, because they also should feel that yes, because of their share, there are a lot of students entering our life. It's because our commitment towards you is to make sure that we come and let you know what are the things, how you can improve with regards to your learning, because you're all students who have a lot of constraint. So we want to make sure that we become that bridge between you and your dream. Okay, that's the reason. Reshma, no KSKS, if I'm not mistaken. Hi, good afternoon. Anybody who's attending, so please do not hesitate to tell me that you are attending for the first time, just to add on to my knowns people list. And if you're watching for the very first time, if you have not yet liked our page, please do not hesitate to click the like button. Please do not please do not hesitate to click the follow button, so that you will not miss any updates that we want to come in with, or we want you to know about. And do not forget, Neethu Madam is going to come tonight live 10 p.m. the very same page that you're watching, with a new writing depiction note. Do join. We will all be waiting. So looking forward to welcome you there as well. Softy, good afternoon. Right. So what are the things that we have in offer with Neethus Academy. So we have just pinned a number there. You're always welcome to contact that number to clarify your doubts. If you want to know more insights about what Neethus Academy have in store for you, we have an array of linguistic exams that we give training for. There are certain exams which you can go if you're really looking for one particular country. There you have different options available, so you can always choose. The choices are always there for all of you. Rose Maria, good afternoon. How am I? I'm doing, Rose. Thank you very much for asking. How about you? Suman, my student from Mariana, isn't it? Good afternoon. So is there anybody who's attending for the very first time? I'm so happy to see all those icons next to your name as well. So at least the minimum of one icon is there. So that shows the immense support that you're giving us, not only in the very same page that you're watching, but also if you really look into our Telegram group, we have about 50K plus students. So that is all the tremendous support and love that you show to us, because we treat you as our family members, and that's what we are here for. So if you have not yet liked our page, please do like our page. If you have not yet clicked the follow button, please do click the follow button. If you have not yet liked or subscribed to our channels, we have 2 channels. Okay, so if you have not yet liked it, please do click the follow button and like button, subscribe button. We'll be just pinning our latest channel. In addition, we have a WhatsApp channel, so we'll be pinning that as well. Jerry Aloysius, good afternoon. Shiji Bharatan, good afternoon. A very, very, very good morning, good afternoon, and a good evening to all my lovely students. Now, why all these 3? Because we have people from across the globe, and that's what makes this live session more colorful, is because you attend from different nook and cranny places across the globe. Lavina Justin, good afternoon. Sharanya Manu, good afternoon. So as of now, there are no students who have said that they're attending or they are attending for the very first time. So that means you're all there. Okay, good enough. So if you want to get more insights, again, do contact that number. They'll be happy to assist you. All right. And what are we going to do? We'll be dissecting a part B and a part A section. Part A, which already I've sent the day before yesterday, so it'll be the same thing, because we were not able to. 𝐓𝐢𝐩𝐬, sir, I'm from New Zealand, second time attending. Because of time issues, I can't attend. 𝐓𝐢𝐩𝐬, thank you very much for that love and affection that you're showing, because as I mentioned, there are students from different parts of the world. If you really look into as what 𝐓𝐢𝐻𝐬 said, she's from New Zealand. We have people from, of course, India. We have people from different parts of Middle East. We have people from different parts of Africa, Pakistan, Afghanistan, Sri Lanka, Nepal, Maldives, Mauritius, Malta, Israel, you name the country, we have. Minimol, good afternoon. How am I? I'm doing good, Minimol. Thank you very much for asking. Hope you are doing the same. Right? This is the love and affection that all our students have. So grateful for each one of you. So if you have not yet shared the very same link that you're watching, if you feel that this class is going to benefit you, so you might feel that it can benefit others, please do not hesitate to share the link in your social media platform, because you'll never know who can be benefited out of it, because there are n number of students who still are unaware that we are doing such free classes. Please do not hesitate to share if you feel. But every day I'm watching your video. Thank you very much, 𝐓𝐢𝐻𝐬. Very kind of you. Sajita Ratish, good afternoon. Danya Vishwam, good afternoon. Sabina Das, good afternoon. So very, very, very good afternoon to all of you. There we have just pinned the official Neethus Academy WhatsApp channel that we have started. So if you have not yet joined, please do click that link. It is also a free channel. We have 2 Telegram pages only. That is one official Neethus Academy Telegram page where we'll be pinning that link as well, and the other one is an exclusive reading Telegram page. Both are free, but reading will only accept you after scrutinizing. Sabina Das, really miss you yesterday. Thank you very much. Very kind of you. Missed all of you yesterday as well, but it was unforeseen. So once again, really, really sorry for that inconvenience caused. Right, Namita Shahji, good afternoon. So again, as I was talking about the Telegram page, see why that's scrutinizing. Okay, see, we are in an online platform, so you have to be aware that there are, of course, great people available, and also you have fraudulent people available. Even though that is the minimal, but they are there to rip somebody else's money, to ruin somebody else's life. They are always there. So you have to be aware of it. And that is the reason why we are scrutinizing, because the reading Telegram page, we try to scrutinize because we want to make sure that the student have the best of the ambience, the best of everything that we can offer to them. So we don't want them to be disturbed by anyone. So that is why we have a scrutinizing policy, and our admin will be checking, double checking. They'll ask you to send certain details, and then after double checking only they'll be accepting you into that group. Okay, so it might take a bit of time. I know that students also message saying that I have not been accepted, but we have, whatever, whenever you communicate, we always take it to our admin, but they also have certain limitations because the number of requests that they have is an absolute stunner. So it might take a bit of time, but we are definitely looking into all of your requests. Suman Rangi, today I came to thank you, sir, for beautiful strategies and the way your teaching is good. Tomorrow I'm going to give my exam. Tomorrow onwards, maybe I'm unable to join your classes because I'm sure I'll pass. That's an absolute stunner, Suman Rangi. Thank you so much for all those lovely words, and I'm so happy how confident you are with it, and I'm sure that you will clear this great exam, and all our prayers are there for you as well. Okay, so as Suman Rangi was saying, there are n number of students who are going to take that big day, the coming day tomorrow. So from bottom of all of us, our prayers are always there. All the very best for all you lovely students who are going to take the exams tomorrow. All right. Silla, good afternoon. Sarita, hello. Rajimol, good afternoon. And that is the most fruitful thing. What I love about Suman's comment was the confidence that they have got. That should be the thing that you should. I won't come, no problem, because you're going to be there in your dream country. That is all what we are here for. Good. So like what Suman said, I hope all of you would say one day saying that, okay, tomorrow is my exam and I'm going to make it to my dream. Suman, thank you. Thank you very much for that lovely words. Now, are you all ready for today's session? If so, give me a very quick thumbs up and say, I am ready. How many of you are ready? Let's see. There are a lot of new names, but nobody have told me that you're new as well, except Gauthami, who's here for the second time, and she's here from New Zealand. Rosmi Jomi, good afternoon, a very good afternoon. Jinsi George ready? Namita Shaji ready? Very good, very good. See, the only way that I could interact and I would know that you're all there, getting into what is needed is by your comment. Kalai ready, Rishika ready, Danya ready. Excellent. Blessy ready. Sajita ready. Okay, very good, very good. So I can see few students with no icons next to your name. If not, please do click the follow button, like button, share button. Yes. Sharanya ready, Bonnie ready, Sabina ready, Shiji ready, Rajimol ready. Very good, very good. Gauthami ready, New Zealand. One of those aspiring countries and a very beautiful country. So you should be really lucky there. Sanita ready, Suman, yes sir, you are ready. Tomorrow is my day because tomorrow is my birthday too. Advance happy birthday, Suman. Everything going good for you. Good, good. I'm so happy. Silla ready, Joji ready, Suzuma ready, Ashwati ready, Minamol ready, Reshma ready. So I was not mistaken by your name, isn't it? So good. My memory is okay now. Ashwati ready, Neeraja ready. Good afternoon. Lavina ready. Excellent. So on behalf of all Neethus family, happy birthday advance, Suman. So go enjoy your exam as well. Jerry ready, Softy ready. So as we've all said, you're all ready. The question will be popping up on the screen. As soon as the question pops up, do not waste your valuable time. Just do as what you're doing on the day of exam. The timer will be there. So do clock in. And the only thing that you have to tell me is, if you have done the question before, found the answer, just tell me, put a thumbs up saying done, or say done. That's it. Don't write the answers. Okay, time doesn't wait for anyone, is it? Rosmi had just clocked in and said done. Sumanrangi done. Good enough. Jinsi George done. So all of you have clocked in 1 hour before time. Good enough. Sabina done. Minumu done. Okay, good. Silla done. Okay, fair enough. Blessy done. Softy done. Georgie done. Bonnie done. Rishika done. Okay. Sony done. Kalei done. Good enough. I can see a lot of people who are commenting. Namita done. Gautami done. New Zealand. Susamma done. Okay. Danya Vishwam done. Sajita done. Okay. Shiji done. Jerry done. Right. And as you have said that you are all done, so happy because every time at least one student is on the more than the regular people who are always there commenting. So good enough. So what are the things that you have to really look for when you're doing part B? See, part B comes from once they take the part A material, then they'll give you B and C together. One type of question, multiple choice question. In part B, it is 3, and part B is considered to be smaller, where you're expected to do your material anything between 10 to 12 minutes. It's the maximum that you can take. Okay. Spot extract, 3 options where you will have to find the answers. Bubbling the appropriate letter is the only way that they'll take you as whatever that is your answer. So elimination method is the most important strategy that you have to always look into. Why elimination? Okay, students feel that, okay, why should I eliminate? Because that's the best way to find the answer. I'm not saying there is no other way, but the best one. Why? The 2 options to eliminate are always easy to find rather than the right answer. Okay, that not all the questions. Okay, the problem is with mix of questions. There'll be easy, moderate, and challenging questions. So especially with the challenging questions, options to eliminate are easy to find rather than why that came as an answer. Okay. Now, what are the things that you should do? First and the foremost important thing when you're doing part B is read the question, underline the keywords in the question. That is very, very, very important. See, as of now, the questions are smaller, but you will get questions which is like a question type of thing. So underline keywords, understand the question. Now, why it is important? Because if you don't understand the question, you're going to pick a wrong answer. That is the reason. Okay. So what are the things that you have to do? You are not going to underline more than 2 words. The maximum that you can underline is 3. That is if the question is a bit more longer. Now, in this case, it's a very simple one. It is only asking you about in advance directive. So, for me, directive is needed, or let's say you're talking about advanced directive. Let's say 2 words. Fair enough. After that, you have 2 options. One, you can read the answer option, underline the keywords in the answer option, then pick it up from the paragraph, or you can read the paragraph and then pick an answer. Anything is open. Okay, depending on your comfort. Now, what are the things? I'm a person who would always follow, read the question, underline the keywords in the question, then I'm searching for it because I need to know what I'm searching for in the paragraph. Now, before that, let me ask you, what are your answers there? You know what I'm going to ask. Kalei is saying B from middle para, Blessy B. See, it's not just the answer, where you got that answer from. That where is very, very, very important for us to correct you, because we do not just say what it is. We want you to tell us where you got that answer, then we can correct you a bit more better if you have gone wrong. Sumanrangi B, answer starts from 2nd line to the 4th line. Very precise. Thank you very much. Blessy from middle. Georgie B. Okay, all of us saying B, but where? Jinsi George B from middle para. Okay. What about others? Where are your answers? I'm only getting few. Minimol B, midline, okay, fair enough. See, I want all of you to comment. See, others are saying B, don't worry. What is your answer? Comment. Softy B, middle line. 𝐓𝐫𝐢𝐬 B, second line. Okay, fair enough, fair enough. So as of now, it's only B. Danya Vishwam B from middle of the paragraph. Shiji Bharathan B, since and attending. Okay, fair enough. Rosmi B, third line. Susamma Chako B, middle line. Saiju John B. Rajimol B, second line to third line. Silla B, third line. Okay, fair enough. Jerry B, all right. Sajita, attending physician, terminal condition, very good again. Selecting where that is there. Georgie, second to fourth lines. Okay, fair enough. Right. So you have all said B. None of okay. Bonnie is saying C from last line. Fair enough. So I have at least something. B and C. We'll never know which is the answer. Okay. There are times where students have all gone against and only one person has got the right answer. There are possibility. Namita Shaji B from third line, Sabina B from middle part, Soni Raju is also saying C. Now C is picking up, is it? So C and B are the two options that is there. Rishika B from middle portion, okay, fair enough. Now let's go and see what is the thing. So the question is very simple. It is not asking anything or it is very straight. It's saying in advance directive. What is it? So now let's see what are the options that is there with us. Okay. Now, patients make decisions about his or her treatment. So who can make? In this case, very straight, patient is making treatment decisions. Okay. An attending physician. So attending physician can withhold medical interventions from a terminally ill patient. So withhold is a very important word, medical intervention. So that is it. So make decision treatment, withhold medical intervention, and then the final one, family members have the authority to interpret. So family authority interpret along with physician. Let's see whether that is also there. Now living will. So it is talking about will. Now let's see. A living will is the oldest type of healthcare advance directives. So what is that? In advance directives. So it is a signed, witnessed or notarized. Notarized means it has to be validated by. C option is opposite. Okay, let's see. Document called a declaration or directive. Okay. Most declaration instructs an attending physician to withhold or withdraw medical intervention from its signer if he or she is terminal condition and is unable to make decision about medical treatment. So in directive is attending physician can withhold, so slightly pointing into C. But let's see. Okay. Since an attending physician who may be unfamiliar with the signer's wishes and values has the power and authority to carry out the signer's directives, certain terms contained in the document may be interpreted by the physician in a manner that was not intended by the signer. So they can do whatever it is. Okay. You can't see my marking, is it? Okay, let me see. I'm just trying to see, okay. Right, let me see. Are you able to? Okay. I'm just trying to draw and see whether it is coming or not. It's not coming. strange things do happen, isn't it? I'm really, really, really sorry for that. I couldn't see your marking. Some technical glitch. Okay. We'll see. Anyway, hope it does. As I mentioned, it's downpouring in here, so there are certain things that we're not able to look into. Okay. So what are the things that we have to really look for? Okay, now just the material will come on the screen. Okay, but just to just be trying to rectify. Maybe we are able to, right? So it does happen, isn't it? So it's all, even though the advancement of technology and all are happening, there are these things called unforeseen, isn't it? Very kind of you for those kind words. Yeah, Kalai is saying no problem, we will adjust. No, we want to make sure that you're all benefited. So we're just trying to rectify it. So till that time, always remember, when you're underlining also, you have to make sure that you're underlining what are the important words only. Yeah, what are the important words? That is the thing that you have to really look for. Okay, Manju Merita, late, but still, I know. Thank you very much for all coming in. And I think, good afternoon, I'm late. Yeah, no problem. So now, I hope we have rectified, isn't it? So are you able to see now? Because we never wanted you to feel sad at any given time. The maximum we will always look into. So now let's see. Okay, now can you see, isn't it? Now I'm just going to read again. Okay, living will, now it is visible. Okay, fair enough. A living will is the, so now let's go and see. So family members, now they're talking about family members, isn't it? So family members and others who are familiar. Okay, so signer's value, wishes have no legal standing. Now see, this no have made the complete difference, isn't it? No legal value. Now family members have the authority means they can do whatever, but the text is clearly refuting it, saying that they have no legal standing to interpret the meaning of the directive. So this is a straight eliminator, isn't it? Understood? C is a straight eliminator because they're clearly saying they don't have any legal standing. So no. A patient can make decisions about his or her medical. No, that is nowhere mentioned as well. Or you can say patient can make. See, they are clearly saying what? Patients are unable to make the decision. So you can say even this is opposite. This is also opposite. So it's a very straight answer. Why D? The simple logic. Why A and C is opposite mentioned. Now where do you get that? You get that from most declaration instruct an attending physician to withhold or withdraw medical intervention from its signer if he or she is in a terminal condition and is unable to make the treatment. So B is the right answer. So Kalai, keep on dancing. Siminibu, B from middle. Bonnie, do not worry. This happens, isn't it? That no made that change. That no. Namita, keep on dancing. Jinsi, George, keep on dancing. Sabrina, dance. Siminibu, yes. Minnu, Mol, enjoying. Rishika also dancing. Good enough, good enough. Siji Bharatan, yes, got it right. Good enough. So all the students have got it. Almost all the students. Anu Sepan, keep on dancing. Sajita B, good enough, keep on dancing. Softy, yes, do enjoy your achievement, isn't it? Susama, thank you very much for that. So what are the things? Gautami, New Zealand. Yes, Kalei, I felt it is very strange answer for all. I I felt it is very straight answer all because of you. No, it is all because of your hard work. Do not take anything away from you. Because I am only telling you are the one who's doing. Rajimol, keep on dancing. Suman enjoying. Keep it up, keep it up. So any doubts with regards to any of those things that I've told you or anything that you are confused about? Is there any doubts that you want me to clarify? Or shall we go to the next one, which I've already shared? What is today's topic? What is today's party? Tell me, what is today's topic? Most importantly, how you felt about today's topic. That how was very, very, very important for us because by looking at your valuable feed only, Neethu madam will be making the next material. So she should know what are your insight and definitely, mark my word, definitely it will be taken into consideration. All right. So whatever, see, we try to give the utmost consideration to whatever the students, whenever they tell, we will never take anything away from them. We are always confident on the aspect, whatever that we have come up with, we have developed, it's all because of your valid feedback. We'll take as much as possible. So Softy, thiamine hyperplasia. Yes, sir, a bit tough for me. Fair enough. Manju Merita, the topic. Silla telling the topic. Manju saying easy. Fair enough. Blessy is enjoying, is it? Very good. Tricky agency, George. Okay. Difficult to me. Okay, fair enough. Blessy easy. So that was the laugh that you had. You had an easy material, is it? Easy one, Rajimol. Okay, fair enough. Little bit tricky, Rishika. Minimal, easy material. Okay, little tough. So I think considering it is a bit on the challenging part, is it? But nice material. Okay, I like that. Bit tricky, but nice material. Powerful tool. Elimination is a powerful tool. Thank you. Pleasure. It was difficult to someone. Okay, fair enough. So basically, that is what I mentioned. A bit tricky on a bit of challenging. Fair enough. Gautam is also saying little bit tricky. I didn't do because I just received. No problem. You can do and enter. So once again, I know that you will be leaving. So all the very best for your exams tomorrow. Make sure that whatever you are doing, do it with the utmost confidence. Do not leave any answers blank. Enjoy your exam. Danya, tricky. Lavina, bit tricky. All right. Now let's see whether it is tricky, bit tricky. What is it? What is happening and all those things. We will be looking and dissecting it. However, I want to continue like that today. Fair enough. It's all your choice. Do not worry. Namita Shaji, difficult. I couldn't answer the full question within the time. Let's see. What are the things that we have? Why that way? So what are the things that you have to always remember? See, the most important thing that you always have to remember is the importance of appropriate strategy. So what is the strategy for part A called? It's called skimming and scanning. What is the strategy called? Skimming and scanning. Now what is skimming? Skimming means quick load, scanning means detail load. Okay. So what are the, how much time we have? Only 15 minutes, 20 questions, so 45 seconds per question. You definitely do need to relax. Do enjoy it. No worries at all. So the maximum time in order to do skimming and scanning is you can take about 1 to 2 minutes. But I wouldn't advise, take 15 seconds per text. And when you are scanning, you should know what is the difference. Okay, text A is about this, text B is about this, text C is about. You should know how to differentiate. Because 4 texts will be different to each other, but it will be based on one common theme. That's how text A works. Sorry, part A works. Yeah. So now, what is the strategy? The strategy, as I mentioned, skimming. Now, what are you to do when you're doing skimming? You're going to underline the keywords. What are you going to do? You're going to underline the keywords. Don't read word by word. You just have to get an overall idea about. So let's see how it is. Yeah. Text A. Thymic hyperplasia is an enlargement or overgrowth of thymus gland, a part of the immune system located in the chest between lungs and breastbone. It plays a crucial role in the development of maturation of T lymphocytes, a white blood cell, and vital immune system response in non-cancerous, characterized by the increase of number of size cells and thymus. Thymus occur due to various reasons, including physiological changes, childhood, adolescent, medical condition, response to increased demand of white cells, Informally for X in infants and children, thymus plays a crucial role in the development of maturation of human child during early life. Likewise, see there are several types. So types of thymic hyperplasia is going to be mentioned in text B, where they are saying physiological, reactive, lymphoid, germinal. So all those things. The others are also important, but I'm just going to tell you a very quick way. Okay, here are some of the symptoms. So this is going to talk about the symptoms and details related. So anything on the aspect of symptom, go to text C, chest discomfort, difficulty breathing, cough, superior, SPCS. And then text D is going to talk about management. So anything which is required, it will be there with regards to management. Now after doing this, you're going to go to the question. Underlining keywords in the question and referring keywords is the only way to find the answers. So let's see how it is. If your skimming is proper, 1 to 7 is a piece of cake. Why? 1 to 7 is called match the following question, where you're only expected to write the answers which can be A, B, C or D. Nothing else. Because you may use the appropriate letter more than once. Be aware of the type of question and the instruction. It has to be by hearted by you. Clear? After that, underlining keywords. Common diagnostic technique to detect abnormality in thymic hyperplasia. So where are they talking about the common diagnostics? So they are talking about the common diagnostics where? They're going to talk about the common diagnostic. A lot of common diagnostic says MRI, all those things are mentioned where? It is there associated in D. So the answer to question number 1 is D. Okay. Now, cite the main indicators of SVCS. Okay. Now, diagnostic techniques, abnormalities. That is where that question. Yeah, all of you got that. Very good. Cite the main indicators of SVCS. So SVCS, I know I just underlined SVCS. So do I need? I'm not going to worry about. I'm going to put it as C. Good enough. Which group of people more susceptible? Because it clearly says infant and child in text A, because that was supposed to be a keywords. So this is why how you refer keywords. So question 4. A kind of thymic hyperplasia develop as a result of some allergic reaction. So kind, develop, allergic. So types are there. Where? Now where? Allergic reaction is the next question. So allergic reaction is as such there. So my answer is B. Understood how you're going to refer? Now question 5. Neglected factors in the evaluation technique which would cause thymic enlargement. So neglected factor, evaluation technique, enlargement. So where are they talking about all these? Should be definitely there in enlargement. Is there? Thymic enlargement is also there. So do we need to have any second thought? The answer is D. Question 6. Important functions. So where are they talking about the important functions? Definitely it is spoken in text A in the very first paragraph. So the answer is A. Understood how you're going to refer? How? Lymphoid thymic hyperplasia. So lymphoid, it should be definitely there. It is there in B, isn't it? It is one of those types. So really no need to worry about, because there is no other place where it is. So the answer is B. So I have finished my 1 to 7. Please be kind enough to tell me what are your total scores out of 7. Now in the meantime, next set of questions, these set of questions starts from 8 to 14, and these are called short answer question, where the answer can be as simple as that of a word, a number, or a combination of word or a number, or a short phrase. See, the short phrase can be anything between 2 to 3 words generally. It will not be more than that, but times when it is absolutely needed only, you write, but do not write more than 4 words. Okay, general thing will be always between 2 to 3 words. Strategy doesn't change, only the question pattern changes. The additional visual test conducted if the result from the chest CT shows issues in the thymus. So this should definitely be a lot of 7. Chiji, Rishika, 𝐓𝐢𝐩𝐬, 𝐓𝐢𝐩𝐬, Manju Merita, Joji, excellent, excellent. Sabina, very, very good. Keep it up. Danya, good enough, good enough, good enough. Now, where are they going to talk about? So, chest is there. Additional imaging. So, imaging is not biopsy. So, what is the next imaging thing they are mentioning? It is MRI with CSR. I'm so happy. Oh God, just got 7 out of 7. Even I. Very good, very good. Do enjoy your achievements. So, MRI with CSR is the answer. MRI with CSR. Good enough. Next, an autoimmune disorder. See, an autoimmune disorder in association with overgrowth of lymphoid tissue in the thymus. So, over issue, thymus, all those things should be there somewhere where? In B. Now, autoimmune disorder associated with myasthenia gravis, MG, any of these is okay. MYASTHENIAGRAVIS, or because they have given the abbreviated form, you're always welcome to write the abbreviation as well. Good enough. So type, blood cell, nurtured, immune response. So what are they going to talk about? So the answer should definitely be from, it plays a crucial role in the development and maturation of T lymphocytes. T-lymphocytes. See, you have to mention, if it's a hyphenated word, please do stick to as what is given in the text. Do hyphenate it. Question 11. The vein that carries blood to the upper body of the heart is called. So what is a vein? So it should definitely be somewhere in C. Why? The vein and all those things are mentioned. In rare case, the enlarged thymus can compress the superior vena cava, a large vein that carries. So it is a 3-word answer. Superior, SUPERIOR, VENA CAVA is the answer. Question 12. Oops, it just went, isn't it? I'm sorry for that. It is among the types. So types, straight away go where? Should be there in B. Thymic hyperplasia. Which one is considered as a typical form? A typical form means common, is it? So a common type is what? It is physiological. So the answer should be physiological, or you can write normal. Anything is okay because they have given like that. PHYSIOLOGICAL, or you can write normal. But the safest and the most appropriate one is physiological. Question 13. Which sign of thymic hyperplasia has the nature of chronicity during its occurrence? So chronicity during its occurrence and all. So it should be there somewhere in C. Why? Irritate and result in persistent cough. So what is the chronicity? It is about the cough. COUGH. How long? So definitely a duration. Should the treatment be followed by test results shows a glimpse of thymic. So when are they going to show us? Slight thing. So where are they going to talk about? It should be there somewhere in D, isn't it? A glimpse. So where are they talking about glimpse? So suggestive of hyper. That means glimpse. So what is the time period? It is 6 months. Excellent. Now that wraps up short answer question. Also the final set of questions, these are called fill in the blanks question, where very similar instructions, but you have to be very cautious with the redundancy, especially with the articles. Same strategy. An enlarged thymus can likely compact and cause dyspnea. Now where is dyspnea mentioned? Is there anywhere? So dyspnea, you know that it is causes difficulty in breathing. So difficulty in breathing is called this. Now where are they talking about? So they are talking in text C, isn't it? Difficulty in breathing? Yes or no? They're clearly saying when the thymus gland grows larger, it can potentially compress the airways, leading to difficulty in breathing. So the answer is airways, AIRWAYS. Question 16. The patient should undergo dash or dash if mass persists post repeat imaging. So undergo dash and dash. So imaging. So it should be definitely somewhere in Text D. So what are they talking about? They're talking imaging what happened if they have mass, discrete mass and all those things. So should undergo biopsy or surgery. BIOPSYSURGERY, or you get it from a very straight answer, repeat imaging. So this is the most appropriate answer. Why? Mass persist, biopsy and surgery. So two places, but here it is more clear. Okay, very good. The airways is the most appropriate answer. Okay, because in the is already mentioned there. Now, the cough that gets generated from thymic hyperplasia, non-productive or coupled with. So what are they talking about? Non-productivity coupled with. So again, it is going to talk about accompanied by the production of mucus. May be dry, so that means non-productive. Non-productive means it's not producing mucus. So it is producing mucus. So MUCUS is the answer. In the dash, many inflammatory conditions remain triggering factor. So in the dash, which is the, so where are they talking about all these triggering factors? So in reactive, there are triggering factors, isn't it? What are the conditions? There are lots of conditions. So triggering factors is there in reactive thymic hyperplasia. So three-word answer, REACTIVE. Why inflammatory? It is already there in the question. So don't write inflammatory. Inflammatory is wrong. Thymic hyperplasia. 3 words. Even though condition is characterized by an expansion in the count and cell dimensions of thymus, it is dash in nature. So something which is asking about, so it should be definitely there in A, isn't it? So what are they talking about? Is it what in nature? It is clearly saying it is non-cancerous in nature. So non-cancerous, NONCANCEROUS. Production of mucus, production is there, no? Mucus only, yeah? The ultimate question, germinal centers are regions, lymphoid tissues multiply and evolve. So where are they talking about? Definitely it should be there in B, isn't it? Now lymphoid is here. So what are they talking about? Involves the overgrowth of lymphoid tissue with the thymus. It is commonly associated with this. So what are they talking about? They're talking about the, sorry, marked it wrong, germinal centers, isn't it? So lymphoid tissue where B cells. So the answer is capital BCELLS. A very straight answer as well. Any doubts with regards to whatever that I've told you? I have, fired all my 20 answers. Now it's high time that you start firing your total scores. If you have any doubts, please be kind enough to clarify. Any doubts? Non-cancerous condition is not needed. Non-cancerous in nature. 17 Shiji, good enough. 16 softy, okay, good enough. See, and when you really go back and see those missed ones, okay, we feel it, oh my God, how did I miss this, isn't it? And you said you didn't find the answers. All the answers were there right in front of you. That is because we are trying to give you as much exposure. 19 Gautami, very good, excellent, keep it up, and she is also enjoying from New Zealand. Good enough, Kale 18, Silla 17. Very good, Jinsi George. So question 12, can we write physiological thymic hyperplasia or only physiological? See, the question is what? The question is clearly asking you the thymic hyperplasia is already there in the question, isn't it? So you can't. Rishika 19, excellent. Rajimol 18, excellent. Minimol 20 out of 20, absolutely good enough. The first person to tell me 20. Rosmi 18, Manju Merita 19, good enough. Ashwini 18, excellent. Even though you said tricky, tough, and all, you're getting good. That means about the amount of input that you have put, the amount of time resourcefully that you have inculcated, that is reaping all those things. Danya 17, good enough. Thank you, Jinsi. Pleasure, pleasure, pleasure. As you have started saying, I got 7. Fair enough, fair enough. Good enough, isn't it? But I did only 7. That's because you are in a relaxed mode. This is how you should be going and attending the exam. Take it like that. I got all the answers because of you. No way. All your answers are because of your hard work. Do not give anything to anyone. It is your hard work and you should be proud enough of that. Good enough, Softy. Thank you very much. Susama 15 only, no problem. You go back and see why you missed that. That's how you learn. All right. So I'm going to miss you all for the next 2 days. And before I leave, all the very best for all my lovely students who are going to take the exams tomorrow. From bottom of my heart, my prayers are always there, and I'm sure that you all will have a lovely day tomorrow. Make sure that all your answers are there. Do not miss any questions. Be confident, no matter whether it is writing, reading, speaking, listening. Do with the utmost confidence. What you have done so far is what you're going to reap tomorrow. Right? So until and unless I'm going to meet you all for Monday, I'm going to miss you all for the next 2 days, but still you need time to relax. Do enjoy your happy weekend. And from all of us, from Neethu's family, adios from all of us. God bless you all. Take care. Bye.